Welcome to Generation Nurse. Today I'm going to be talking about APGAR scoring. This is the first test that a baby must pass when they are born. APGARs were invented by a nurse named Virginia APGAR, and lucky for us, it's an acronym as well, so it's easy to remember. And again, this is a measurement of the newborn's transition into extrauterine life or directly after birth. We are going to do this at the first minute, at 60 seconds of life, and then again at 5 minutes, and then we'll continue to do them in 5-minute intervals if the baby is not transitioning well. So, the first A in APGAR stands for appearance. Really, they're looking at the color of the baby. And then P is for pulse. G is for grimace or how they respond to stimulation. The other A is for activity. So what does their muscle tone look like? Are they kind of limp or are they nice and coiled up? You know, they're used to being inside of the uterus, so they're used to being nice and curled up, and they should be that way if they're healthy. And then respirations. So let's talk a little bit more about color in detail. So appearance, specifically referring to color, is your baby pale or blue? If they are going to get a 0. If they have acrocyanosis, which means their extremities are blue, they're going to get 1 point. Let's break down the word acrocyanosis really quickly. If you look at medical terminology, it has Latin in it. Acro means extremities of the body, your hands and your feet. Cyan means blue, and osis denotes a process or condition. So when you put it all together, acrocyanosis means blue extremities, or a process that causes blue extremities. This is a normal adaptation for infants. You can see acrocyanosis up to 24 hours of life. This can freak your parents out, so make sure you educate them that this is completely normal. And if you want to give them 2 points, they will need to be pink all over. So remember, 0 is bad, 2 is good, and that is how we score them for color or appearance. The P is for pulse. A normal newborn pulse should be 110 to 160. However, with APGARs, a pulse of 0 obviously is going to get 0 points. If you're going to give them 1 point, that means that their heart rate was less than 100. We need to do some interventions. Suction them, stimulate them, oxygenate them, whatever you got to do. A pulse of greater than 100 beats per minute is going to get you 2 points. So how do we assess the pulse? Well, they used to, back in Virginia APGAR's days, palpate the base of the umbilical stump, and you can feel the pulse in the umbilical stump, and they would count that. However, the gold standard for today is to put your stethoscope in your ears and lay the bell on the baby's apex and actually count the heartbeat. You're going to count it for 6 seconds. You'll see some nurses do this movement with their finger over the stethoscope so that everyone else in the room can see what the heart rate is. Okay, and then you're going to calculate how many beats you can count in 6 seconds. Multiply that by 10 and you're going to get your heart rate. So if you had 12 beats in a 6-second interval, just multiply that by 10 and you have 120 beats per minute. Your baby's going to get 2 points. All right. So just a tip from all of my years of experience, if your kid is screaming, they likely have a heart rate over 100 if you can't hear it because of all the screaming. Next, we're going to talk about grimace. Grimace refers to the infant's response to stimulation or their reflex irritability. So no response to suctioning or rubbing the baby gets 0 points. Back in Virginia's day, they used to hang the baby upside down by their feet and spank their bottoms to see if they could get them to cry. Now all we really do is flick or slap the bottoms of their feet to startle them and dry them, of course, which is the first intervention that we do for babies when they are born. If they respond minimally or they give you a little bit of a furrowed brow, just a little, they're going to get 1 point. And if they are actively crying and moving, they are going to get 2 points for grimace. Activity refers to muscle tone. So if they are limp, again, they're going to get 0. Sluggish is 1. And if they are well flexed and coiled, they're going to get 2 points. And last but not least, we're going to look at their respiratory effort. So a normal newborn respirations is 30 to 60 breaths per minute. No respiratory effort gets 0 points. If they're grunting or they have a weak or slow respiratory effort or just gasping, they're going to get 1 point. And crying or normal newborn respirations is going to get 2 points. So what do you do with all of these points? You're going to add them up. If your baby has a score of 8 to 10, they are healthy. You're going to dry the infant and keep them warm. You can do this many ways. You can put them skin to skin with mom. You can leave them on the radiant warmer as long as it is on and connected to the infant so that they don't overheat. A score of 4 to 7, you're going to stimulate your baby using the towel to dry them. You can suction them, and then you are going to repeat the score in 5 minutes. So when your score, every baby is going to get a 1 minute and a 5 minute score. But if their score is less than 7 at 5 minutes, you're going to continue doing scores in 5 minute intervals. Make sure that you chart what your interventions were and why you had to keep going. A score of 3 or less, you're going to be doing some serious resuscitation. So make sure you do those APGARs in 5 minute intervals, and you're always going to document what interventions you're doing, such as suctioning, positive pressure ventilation, intubation, medications, you name it. Whatever you use to get your baby's score up, you got to make sure that you chart it in minutes of life. And just a little tip from experience, as the baby turns pink or you have established an airway that is giving them a normal respiratory effort, you're going to give them points for that, even though you're doing the work essentially. Once you have them intubated and stable, they will then at that point go over to the NICU for further evaluation, testing, and stabilization. So let's practice this a little bit. So here we have a baby that at 1 minute of life on the left-hand side has acrocyanosis. I know the picture, they both look pale and blue. It's just a little bit of photo editing needs to be done. But let's just say, for the sake of argument, the baby on the left, it has acrocyanosis. So remember, they're going to get 1 point for that. They have a pulse of greater than 100, so you're going to add 2 points for that. Grimace, I see a little furrowing of the eyebrow, but it doesn't look like this kid's in a full-blown cry with stimulation, so we're only going to give 1 point for grimace. There's some flexion, not full flexion, so we'll give another point. And then let's say, for the sake of argument, this kid has weak respiratory effort. So our total on the left is going to be 6 points, okay? We're going to continue drying and stimulating the baby. And at 5 minutes, we have a pink baby, completely. Hands and feet, all the way, pink. Heart rate is greater than 100, so we're going to add 2 more points. They're crying and showing good response to stimulation. Make that 6. Good flexion, 8. And again, respiratory effort and full-blown crying means another 2 points for a perfect 10. Good job, guys. You resuscitated this baby well. Please, if you've liked this video, like it, subscribe to my channel, more videos to come.